The In-Home Supportive Services Program, or IHSS, makes it possible for you to remain safely in your own home, where you can enjoy personal freedom and independence and continue being a part of your community. The purpose of this video is to provide a quick overview of IHSS and how it works, and also hear IHSS recipients and caregivers share their own experiences. IHSS provides services to income-eligible people over the age of 65 and the blind and/or people with disabilities. The goal of the IHSS program is to allow you to live safely in your own home and avoid the need for out-of-home care. IHSS allows you to hire someone to help out with services such as housework, laundry, meal preparation, shopping, and personal care. In addition, paramedical services such as wound care are also available as part of the IHSS program. In order to qualify for IHSS, services almost always need to be done in your own home. This could be in a house, apartment, hotel, or home of a relative. You, the recipient, can choose to live in any type of home you want, as long as it is not an acute care hospital, skilled nursing, intermediate care, community care, or boarding care facility. There are times when some services can be provided outside of your home, such as when you're accompanied to the doctor. There may be times when services may also be provided in the workplace or when you travel on vacation and the provider accompanies you. Just make sure to tell your social worker in advance to make sure these services will qualify for IHSS payment. IHSS is a Medi-Cal program and is funded by federal, state, and county dollars. Therefore, you must meet all Medi-Cal income eligibility requirements to receive IHSS services. IHSS is a huge program in California, made up of nearly 1 million consumers and providers. The federal and state governments provide oversight and direction to the counties. These counties are responsible for managing the IHSS program on a local level. The counties enroll providers and recipients in the IHSS program, conduct assessments, answer questions about IHSS, and participate in fraud detection activities. The Department of Health Care Service Auditors and the County District Attorney's Office and welfare investigators all investigate potential fraud when cases are referred to them. So how do you get to be a part of the IHSS program? The first step is to contact the In-Home Supportive Services program in your county.
My doctor told me that if I did not get help at home, that I would be put into a nursing home, and I did not want to go to a nursing home, so I initiated getting help from IHSS.
I spoke about what my needs were on the phone with the worker, and then we made arrangements for a home visit.
A social worker will come to your home to conduct an assessment. This assessment process includes identifying if IHSS may be needed for you to remain safely in your home, how much help is needed, how much time it takes to provide the services, and how often they must be done. The social worker will take into account the different levels of need on both your good and bad days.
Well, then a social worker comes out to the house and talks to, in our case, my husband and myself, what kind of help do we need.
And we just talked about things that I needed help with. And I let her know that as far as personal care, there was very little I could do for myself. She'd ask how long my routines would take, how long it would take me to get up in the morning, how long it would take me to use the restroom, how long it would take me to go to bed at night, how long it takes to do laundry, to go shopping. So it was all, a lot of the questions that she asked, I remember, were really time-focused.
Some of the things the county will consider when determining your IHSS eligibility are your medical condition, living arrangements, and any resources that may already be available. A licensed healthcare professional, which may include a regional center clinician or public health nurse, will also need to complete a healthcare certification form provided to you by your social worker. The form will certify your need for IHSS, and it must be completed and returned before services can be authorized. You, the IHSS recipient consumer, are the employer. So just as all employers do, it's your responsibility to screen, hire, supervise, train, sign timesheets, and if necessary, terminate your provider. It is also your responsibility to keep a record of hours worked and limit your provider to the number of hours that have been authorized each month. Make sure your provider does not work more than 40 hours each week. When you have to hire or terminate a provider, it is your responsibility to let your social worker know. Also, if a registry provider from your public authority is involved, let them know as well. After you've been approved for IHSS, the county will send you a Notice of Action, also known as a NOAA. The NOAA will list what services have been approved, how much time is authorized for each service, and how many total monthly hours have been approved. So let's say you're unable to do house cleaning or you need help with personal care. IHSS can help pay for you to have help with personal care services like dressing, bathing, feeding, and toileting, house cleaning, cooking, laundry, shopping, accompanying you to and from medical appointments, paramedical services, and other services such as protective supervision. The county is required to authorize only the services you need to remain safely at home. It's important that you and your provider go over your approved services and the number of hours authorized.
So then I needed to just figure out how to put those numbers into a daily routine with my caregivers.
It's good to sit down and talk to your worker and figure out what needs to be done and what's approved on your tasks.
IHSS will only pay for a service or task that has been authorized, and they will only pay for the specified number of hours approved. Some of the things IHSS will not pay for include moving furniture, paying bills, reading your mail to you, caring for your pets, including service animals, gardening, sitting with you to visit or watch TV, taking you on social outings, reimbursement for gas and transportation expense, time waiting for you in the doctor's office, and repair services. If you have more than one provider working for you, make sure that the combined hours do not exceed the total hours authorized. In some cases, all you may need is a little bit of help to learn how to do certain IHSS tasks yourself. In these cases, IHSS may authorize some teaching and demonstration hours. The goal of teaching and demonstration is to allow you to become more independent. This means that after your training, you should need less help and your hours will be reduced. If you have questions about what tasks or services can be completed, be sure to talk to your social worker first. And don't forget, you shouldn't ask your provider to do anything that is not included in your NOAA. There may come a time when you may require medical assistance. In IHSS, services that require authorization and training by a medical professional before they can be provided are considered paramedical services. Some examples of paramedical services are administering medication or giving injections, blood urine testing, wound care, tube feeding, and treatments requiring sterile procedures such as ostomy irrigation, catheter care, and suctioning. It is very important that your provider does not perform any paramedical services for you until they have received proper training. Before this training can be done, a licensed healthcare professional, which may include a regional center clinician or public health nurse, must order and direct the paramedical services. This healthcare professional will need to complete a paramedical form, and you will also need to sign it. The completed form must also be received by the county before your provider can be paid to do any of these services. The goal of the In-Home Supportive Services program is to provide support and services that will enable you to continue to live safely and independently in your own home. You, your provider, and your social worker are all part of a team to help make the IHSS program work for you.
The advantages of IHSS, it's allowed us to live in our own home, to live together in our own home, to be able to stay in the community.
IHSS means that I'm not in a nursing home, I'm not in the hospital. It means that I have somebody that cares for me here at home. It means the world to me.
I managed to move away from my family, which, as somebody growing up with a disability, was just such a liberating moment, knowing that, wow, I can really survive out there in the world without the support of my mom and my dad.
It has allowed us to continue living, and that's where I can put it.
We hope that this video has been useful in providing a brief overview of the IHSS program. If you are aged, blind, or disabled and want to continue living safely in your own home, you may want to consider your eligibility for the In-Home Supportive Services program. For more information, contact your local county IHSS office or visit www.cdss.ca.gov.